Good day to you, employees of Parkview Nursing Care Center. My name is Ross Shamburger, and I am the insurance agent that handles your health insurance with Blue Cross Blue Shield and your dental vision insurance with Principal. The renewal date for your group is November 1st, so we have that renewal information in, and this is your open enrollment period, where if you want to make a change, you can do that during this open enrollment period for an effective date of November the 1st. So keep that in mind. We did have a small increase in the health insurance. It went up a little over 6%. So unfortunately for you, you're going to participate in that increase. Part of it's going to be paid for by the Parkview and part of it by you. So your monthly payroll deduction will change from $100 a month to $120 a month. So know that. The dental vision insurance rates did not change, which is good news. So they are exactly the same. So if you're on the dental insurance, the vision insurance, you don't have to do anything. If you're not on the dental and vision insurance and you want to get on, you can do that effective November 1st. If you want to add dependents, you can do that effective November 1st. If you're not on the health insurance, you can get on it November 1st. And same thing, if you want to add your dependents, you can do that with Blue Cross effective November 1st. We have brought down and provided for you. Each of you should have an enrollment packet that looks like this. So what I'm going to do is be going through that at this point. So the first page is going to be just the open enrollment letter that lets you know this is open enrollment. And if you have any questions, certainly you can call our office, and all of you have that number because I've provided enough pins, hopefully, that those have been given to you. Our phone number here in Lubbock is on the pin, so feel free to call me again anytime, Ross Shamburger, and if I'm not available, ask for Ashley Allen. They're at the 783-8959. Also, you can, questions can go to Tracy Woodward, who handles that at MSC, who also is here in Lubbock. So there's your open enrollment letter. Right behind that, you're going to find two summaries of benefits and coverage. And this is what they look like. All right, so you have a choice of two plans on the health insurance. At this point, everybody is on the HMO. We do have a PPO available for you, but I'm just going to spend time going through the HMO because nobody, as of today, is currently on the PPO. So on the HMO, if you'll start there, you've got a $3,000 deductible today, and that is going to remain at $3,000. Nothing has changed there. The maximum out of pocket for 2019, based on the Affordable Care Act, was $7,900. The Affordable Care Act did change that, so it's going up to $8,150 maximum out of pocket beginning November 1st. So not many of you are going to have a claim that big, so that's the portion that you would be out of pocket. But it did change by $250. If you turn the page, on the back of page 1, it shows you your office visits. Today, that is a $40 office visit to see your primary care doctor, $70 to see your specialist. Effective November 1st, Blue Cross changed that to where it's $50 and $80. So $50 to go see a primary care doctor, $80 to see a specialist. So that will change. Keep in mind, on the HMO with Blue Cross, you are required to get a referral to see a specialist. So that $80 copay would be after you've had a referral to go to an in-network specialist. So same thing with the primary care doctor. Please remember, you've got to go to an in-network primary care doctor. And I know they're in Muleshoe. All of the doctors were there. Last year we looked, and it was good, so there have been no issues. We've not had one complaint on it. But if you're getting referred into Lubbock, please remember your hospital network in Lubbock is UMC or Lubbock Heart Hospital, and you must use an in-network provider on the specialist side, and you have to have a referral. Alrighty? So you can change your primary care doctor anytime. All you do is call the number on the back of your ID card with Blue Cross, tell them that you want to change from your current PCP, which stands for primary care physician, to a new doctor, and you give them the name of that doctor, and they will change that effective the first of the month after you've made your call. And you can actually call them if you wanted to. Every month they'll allow changes on your PCP, not more than once a month, and I guess that would be 12 times a year if you wanted to do that. All right, so let us know if you have any problems with that. We're here to help you. Please know I don't work for Blue Cross, I work for Parkview. So if you guys have a problem, you need to call here and let us help you. As you go on down the page below those office visits, preventive care screening is still no charge. If you're going in for a preventive care checkup, nothing's wrong with you, you just want to get a checkup. So for ladies, that could be a pap smear, a mammogram, get your cholesterol checked, for guys, PSA tests, those type of things. All right, there is no charge when it's filed as preventive care. As long as your doctor files that as preventive care, there should be nothing. You don't pay a copay or anything. All right, diagnostic test. They're going to start running different tests on you. Keep in mind, you've got a $3,000 deductible. Once you've met that deductible, you pay 30%, the insurance company pays 70%. Once you hit that $8,150 out of pocket, I know that's a lot of money, but once you hit that, then everything that's approved is paid at 100% for the rest of that calendar year. All right, deductibles do start over in January 1st. If you have met part of your deductible prior to November, it just continues on, because again, deductibles all run on a calendar year basis, as well as does the co-insurance. All right, imaging and PET scans, that type of thing, $200 copay plus your 30% co-insurance. Your next page, when you go to page 3 of 7, your prescription drug copay is not changing, so it is still $0. For preferred generic, $10 on non-preferred generic. Non-preferred brand name is going to be, or preferred brand name is $50, non-preferred brand name is $100. Then we've got preferred specialty drugs set at $150 and non-preferred $250. That is exactly what it is today, and it will remain that for next year, so that is not changing. Facility fees, still $200. Physician, once you've met your deductible, paid at 30%. The health plan itself looks just the same, other than the $81.50 went up from $7,900, and your office visits changed, that $10 amount. Other than that, everything's the same. So as you go on down now, we're on page 4 of 7. Emergency room, $500 per visit copay. Please remember, emergency room is the most expensive place that you can seek care. And emergency rooms are for what they say, emergencies. So if you've got the flu or some of those kind of things, remember you can use your MD Live, which is your telephone, or where you can call and talk to a doctor on the phone. That's provided for you, and there is a flyer that we're going to cover here in just a second about MD Live. So you can call MD Live anytime, any day, from anywhere. You do pay the office visit copay, but you're talking to a doctor who can help with those simple things like sinus infection, upper respiratory infection, bladder infection, the flu, diarrhea, just those kind of things, pink eye. Okay, so keep that in mind. We want you to use those things. Stay out of the emergency room. The average cost for an emergency room visit is well over $1,000. It's going to apply to your deductible, so we want to save you some money, and also we want to save the plan some money, because next year's rates are going to be based on how much usage we've had in just not your group, but in all groups. But still, we need to cut down on utilization. We're trying to preserve your rates. All right, going down the page, there is an urgent care $80 visit that you could use. So if you can't get in to see your PCP, it's on a Saturday or Sunday. I know y'all probably don't have an urgent care center in USU, but if you come over to Lubbock, there's some of those around. It costs you $800. Just make sure you're going to a PNS, a UMC clinic on those. Facility fees, when you go in the hospital, there's a $300 copay at the hospital. Physician, again, is subject to your deductible and then paid at 70%. You pay the 30%. There is coverage for mental health. If you're pregnant, coverage is the same. Still got the $3,000 deductible, 70% that they pay, 30% that you pay. Just going again, right on down the page, there's home health care, rehab services, skilled nursing facility, durable medical equipment, hospice services, all are subject to your deductible, and then paid at 70%, leaving you 30% to pay. All right? So basically that is the HMO, very little change. The out-of-pocket, which won't affect most of you, unfortunately the office visit increased by $10, but other than that, keep in mind the number one thing people use is the prescription card, and that did not change. Okay? So you've got this is the HMO. If you want to keep it like it is, you don't have to do anything. You do not have to fill out a new form unless you're changing something or enrolling for the first time. Plan 2 is a PPO. Now that includes Covenant Hospital, along with UMC and Lubbock Heart Hospital, North Star Surgery Center, and some other places. It's also a $3,000 deductible. The rates are about 40% higher. They're really expensive. But if you want to switch from HMO to PPO, you can do that effective November 1st. No questions asked. Alrighty? So, and the rates for both plans are in your packet. The next page that you're going to come to is MD Live. This is where you can call and talk to a doctor on the phone. Alright? So that is available to you. You do have to pay a copay, but you can do that on a weekend, 2 o'clock in the morning, you're on vacation maybe, and you have a temperature, maybe it's a sinus infection or strep throat, something like that. You can call a doctor. They will call you in a prescription, so you need to have a number where you want them to call a prescription to. So if you're out of town, you may need to do that first, okay? Also, one of the things we encourage people to do on the telemedicine is go ahead and register, and you can go to their website, which is here on the back, and enroll. So you may do that today while you're healthy. Answer all the questions, because they're just like any doctor. They want to know what medication do you take, what are you allergic to, your surgery history, those type of things. All right, so you can fill that out today while you're healthy, and then when you call in 6 months from now and it's 3 o'clock in the morning and you have 103-degree temp and you feel horrible, you don't have to stop and take 10 minutes to do that. You've already done it. Okay, then they just ask you, oh, we see you filled out your information, have there been any changes? And you could tell them no, and then you'll get in to talk to a doctor a lot sooner. The way it works, you give them their information, they screen it, they tell you, yes, we think we can help you. A doctor will call you back, and the average wait time is usually in that 10-minute range. All right, it depends on the time of the year and how busy they are. But for me, we've got this same benefit. They could call you back in 2 minutes. All right, I've had that happen. So use the MD Live. Stay out of the doctor's office when you can. All right, so that will help. Also, another thing that's in your packet here is Nurse Line. You can call free of charge and talk to a nurse anytime, again, any day, and just ask them general questions. You know, you could say, well, my child has a temperature, and this is the amount of the temperature, what should I do? Okay, or my child has these symptoms, should I take them to the doctor? Should I just keep them home and medicate them here? You can talk to a nurse. They give you advice. They can't call in a prescription, okay? But you pay nothing for it. And again, that's available to you 24 hours a day, 7 days a week, from anywhere. So it's called Nurse Line. So please put that on the front of your refrigerator with that phone number. That's what I would do. Next page behind that is going to be your rates beginning November 1st. You got the HMO rates at the top. That's the rate that everybody's on. Find your age, and there's what the new rate is. All right. You can see, of course, for somebody that's age 50, the rate is $466 a month. You're going to pay $120 of that. Parkview will pay the balance. All righty. So they're picking up the lion's share of the cost for you. As you get older, all the way up to 64 plus, $782 a month. Again, you pay $120, they pay $660. All right, so that is good. The PPO rates are right below that, and you can see they're considerably more. Over $1,100 for somebody 64. So it is expensive, but that brings Covenant into the network where, again, with the HMO, you've got UMC, Lubbock Heart Hospital. Okay? All right? Right behind that is an enrollment form. You will not need this form if you're not changing anything. All right? So make a paper airplane out of it and fly it across the room at somebody. But if you're enrolling for the first time, we need it. Or if you're changing anything, adding dependents or changing plans, there's a place right here where you put in the plan that you're picking. And that's where you would tell them, is it HMO or PPO? All right? So only people that need to use this form are those that are making a change or enrolling for the first time. And then behind that are just a bunch of notices that are required. There is a general health COBRA notice. So if you were to leave employment and you're on the health insurance, you can stay on the Blue Cross for up to 18 months, but you have to pay the full cost. That's the first one. Here's a HIPAA notice that just talks about privacy and special enrollment rights. So one thing that's important for you guys to know, if you have a claim, I don't know it, Tracy doesn't know it, nobody knows it at MSC, nobody knows it there at Parkview. All of that type of information is private. Blue Cross can't tell us or you that they've had that you've had a claim. The only time we know it is if you call and you tell us. So we are happy to try to help you if you call. Behind that is a health insurance exchange notice, which deals with people that want to get individual coverage through the health insurance exchange. That's the government part of Obamacare. That doesn't apply to y'all, but by law we have to give you that notice. Here's a notice for patient protections. Right behind that, women's health and cancer right notice. Premium assistance for CHIP. If you're not familiar with CHIP, that's where low income people can qualify for help for coverage on your kids. Really important, you may qualify. They tell us a big percentage of the children in Texas that qualify for CHIP don't have it. So you might go along with this, read it, there's a number there. If your kids don't have health insurance of any kind, they may qualify for CHIP. So do that. Again, that doesn't have anything to do with your plan there at Parkview, but again, the Texas law says the employer has to put that notice in there. Newborns and mothers health protection is the next form. Privacy notice, everything's private. Again, they can't tell us anything about it. So those are the notices that we're required to give you, or that Parkview is required to give you. So we make that part of our packet that we give you. So basically that is the health insurance part of it with Blue Cross. Pretty much everything's staying the same. Office visit copay changing a little, maximum out of pocket changing. The part that you pay is going from $100 a month to $120 a month. So, and if you have any changes, you can make them. Keep in mind, when you get on the health insurance, pre-existing conditions are covered immediately. So if you've got some condition that already exists and you get on the plan, it will be covered. And two, if you have any questions or problems, we want you to call us here in Lubbock. Next is the thing that we need to talk about. We've got in there for you as an employee of Parkview, dental insurance and vision insurance with Principal, okay? None of that changed. The rates are identical. So if you're on that, your cost is not changing. The benefits are exactly the same. You can enroll your dependents on the dental but not on the vision, or you can put everybody on the vision but nobody on the dental. They're two separate benefits, and the enrollment form has a place for that. So just keep in mind the plan basically has a $50 deductible. The preventive care is paid at 100% of what is considered reasonable. The basic stuff like fillings, extractions is paid at 80%. You pay 20%. You can go to any dentist that you want to. So you can come to Lubbock, you can go there in Muleshoe, you can stop in between if you want to. Okay? So major stuff paid at 50%. So if you're getting into crowns and inlays and onlays, those type of expensive things, then there is a 50% on the major stuff. So know that. The rates, again, do not change. If you're enrolled and you want to keep it the way you've got it, you don't have to do anything. But this is an opportunity to get on. It's an opportunity to add dependents if you didn't do it originally. So that's the dental. Right behind that is the vision. They use the VSP Vision Network. If you need a list of those providers, feel free to call us. Call your local provider over there, eye doctor, and ask them if they're part of the VSP network. Often they are, okay? So again, none of that changed. The rates did not change. You can go in and get your eyes examined and you pay a $10 copay. All right, so it's a really neat benefit, and I hope you'll utilize that. The cost for those is right here. All right, so $29.11 to get on the dental insurance. For the employee, just $6.98. That's per month, not per payroll. To get on the vision insurance, if you carry your family and yourself, $100.90 to cover everybody. And on the vision insurance, it's only $19.57 a month to cover the full family. So the rates on that remain the same. And then right behind that, you should find an enrollment form for principal. And again, just like with Blue Cross, if you're not changing anything, you don't have to do anything with this. Leave it like it is, okay? And just, again, throw this away. All right, but if you want to enroll, if you want to add dependents, drop dependent, whatever, you can use this form. And when you turn to the second page, you'll see at the top there's a place that you enroll for dental, or you enroll for vision, you decline for vision, and then they want to know, are you covering yourself, your dependents, that type of thing, which is done on the front. Okay, if you're going to cover your dependents, then list them there. And then the place that you sign is over on page 3. Okay, so do that. Again, hopefully it's pretty simple this year. No changes. Unfortunately, I can't be there with you in person. So I hope you did take advantage. I brought you down some apples and cookies today. So COVID relief, I call that. Cookies are good for stress, and of course an apple a day keeps the doctor away. So hopefully you found those there. Open enrollment starts November the 15th, goes to, not November, excuse me, September 15th, goes to October 15th, and everything's effective November 1st. All right, if you have questions, call us. We appreciate you. Thank you for what you do, for taking care of those people there at Parkview, and I hope you all can stay healthy, and we appreciate you. Thank you very much.